With everything that's right and wrong about healthcare, we have a new report just out today from the Nurses Union suggesting ways to improve the system by expanding the scope of what nurses do.
Right, and this one is all predicated on the idea that an expanded use of nursing at all levels will improve primary care for everyone. The idea is that for people who don't have access to a family doctor, and for people who wait too long to get access to their family doctor, that using nurses more regularly, integrating them more into the system, is a way to cut down on wait times, and also is a way to keep people healthier longer so they don't end up in more intensive and frankly expensive methods of treatment.
And we're not reinventing the wheel here. Successive governments over the years have advocated or changed the way that our health professionals practice. Drugstores, for example, pharmacists are now giving flu shots, and of course paramedics are not just in the ambulances, they're in emergency departments doing the triage necessary to try and streamline that process and provide Nova Scotians with faster care.
There's a call to get nurse practitioners into emergency departments so they can deal with patients who don't need to see a doctor. One is to create a fast track in emergency departments that right now are seeing long lines, often involving people who don't really need to be there. There's a call to provide training for registered nurses so that they can write certain types of prescriptions in certain primary care settings. And the other thing that's most notable, and this is perhaps a nod to this government's expansion of home care services, is a wide call for the expanded use of VON nurses in terms of expanded community clinics, in terms of expanded services that they can bring to patients, and in terms of bringing better access to case management for chronic disease patients.
This is not a government report, but it's clearly a report aimed at government. We'll have to wait and see now how long it takes the health department, the minister, to digest what's in here. With some reports, they digest it about as well as a boa constrictor digests a very large animal. So it could be a while before we know what the government decides to do with this report.